Welcome YouTubers, welcome back to the Shawnee Rose channel. Thank you all for supporting my first video, and now I'm back to talk to you about something that I know you all are going to want to hear. You got to stick around to hear the #1 highest paid nursing career. All right, so number 10, RN First Assist. Now, you may wonder, what is an RN First Assist and how do you get into the career of RN First Assist? Basically, entry to practice for an RN First Assist is the BSN. Now, what is an RN First Assist? An RN First Assist is a nurse who is specially trained to work in the OR with the surgeon, and she actually can assist and sometimes actually take over in the surgery. Now, the paid amount that they are averaging for this career right now for the RN First Assist is $96,418 or $51.50. What I want to just make clear for you with the RN First Assist is that in order to get into this role, what you'll need is 200 clinical hours. And to get that, you'll find a surgeon who's willing to take you on as an apprentice of sorts, and you'll learn with him or her and get the experience that you need in order to move on and get that RN First Assist certification. The thing I like about this career is you don't actually have to have a master's degree, it's a certification. And you can get this in up to 6 months or less, depending on the program that you enter. One of the schools that I looked at that had a really good program for this was University of Rochester. And for those of you who are not in the United States and interested in this program, this is a way that you can also gain practice entry here in the United States. Also, I would say look up your universities and colleges in your area, and I'm sure this program is out there and it's becoming more popular worldwide. All right, number 9. Family Nurse Practitioner, $98,408 a year or $47.31 per hour. Now, the reason why it's $47.31 an hour is because of the fact that as a family nurse practitioner, typically you're going to work 5-day work week, 40 hours a week, as opposed to the 36 hours with the RN First Assist. Now, I will say this, I am a family nurse practitioner, and this is certainly an average because you can make a lot higher than $98,000 depending on how you negotiate and also depending on where you actually work. Number 8, Nursing Administrator, $99,730 a year or hourly $47.95 an hour. Now, this one you typically will need a master's of healthcare administration in many cases. However, there are places that you can work and you may not actually need the master's level certification. And it's a broad background, so you can pretty much go anywhere in healthcare, from nursing homes to clinics to actual hospital units. All right, number 7, Pain Management Nurse, $101,916 annually or $48.99 an hour. I think this is a good specialty because you can work in a hospital setting, or you can work in an outpatient setting, or you can work in a pain management clinic. And you are, of course, going to need an advanced certification. Many times they are nurse practitioners who are working in this role. Number 6. Neonatal intensive care, a whopping $101,916 a year annually or $54.75 an hour. I think this is a really good career choice. When I was teaching in the clinical setting, many of my nursing students were interested in this role, and I encouraged them because it is definitely an area we need for advanced practice nurses. Number 5. Certified Nurse Midwife, $103,000 a year or $49.89 per hour. This is a good one if you are interested in specializing in mother-baby care and basically assisting women in childbirth. I think it's a great field, and it's certainly one that has stood the test of time and been around for quite some time. It actually was pretty strong prior to nurse practitioners becoming a big role. So if you're interested in mother-baby and you like, delivering babies or thinking about delivering babies, I think this is a good career option. Number 4. Psychiatric nurse practitioner. This is a good career choice. There are a lot of options and a lot of places that will hire you. You can work in the school level, you can work in a clinic, and you can also work in the hospital. This one comes in at $105,658 or $50.79 an hour. Remember, these are all averages, and you can make a lot less or you can make a lot more. Depends on the region that you're living in, the part of the country, or what country you live in. All right, number 3. Clinical nurse specialist. Clinical nurse specialists are making $106,028 a year or $50.98 per hour. Typically, they're going to work a 5-day work week, and they're also working in all avenues of healthcare, hospitals, outpatient settings, surgical settings. And this one is very similar to a nurse practitioner role. However, they're doing more of the didactic work or specializing in a specific area, but they're not able to actually practice independently like a nurse practitioner, wherein nurse practitioners can prescribe medications and make diagnoses. It's a little bit different in that case. But it's also a really good field. It's a very popular career choice for today, and I definitely encourage you to look into the clinical nurse specialist role. Number 2, general nurse practitioner. Now, I have a little bit of a qualm about the listing of this one. It says that you come in at $107,030 a year annually or $51.45 per hour. And when you look up based on the Bureau of Labor Statistics, which is where I'm getting all of this information from, it says that their primary role is primary care practice. But I kind of beg to differ, because that's really either an adult nurse practitioner or a family nurse practitioner. So if you really are interested in the family nurse practitioner, you are actually going to make just about the same on average. So just keep that in mind. I know you all want to hear this one. Number 1 is CRNA, and that is a certified registered nurse anesthetist. Big field, it's a huge field, and you are going to be shocked when you hear what the average salaries are for this role. Now keep in mind, this is probably the most complex advanced nurse role. You have to go on to school for a master's degree, and even to get into the programs for the nurse anesthetist, you need to have at least 1 year of a level 1 trauma clinical experience in the ICU setting. So this one is one that you really can't just jump into unless you have that experience, that acute care, critical care background. But if you do, it is certainly worth pursuing, and the opportunities are limitless for this one. In this role, you would be administering anesthesia to patients in the surgical setting, as well as even in the dentist office setting or in the hospital setting. It comes in at $167,950 a year or $80.75 an hour. Is that amazing? That is amazing. I am telling you, I actually consider this role. However, I couldn't keep going. I've been through school forever. I do encourage you to keep going, but you got to know your limits. And if you have it in you, this career will be definitely one that will be well worth it. All right, folks. Well, thank you for tuning in. I appreciate your support once again, and I will be back next week or even sooner, because I want to give you some more information about what you are looking for in nursing and pursuing a nursing career. So this has been Shawnee Rose, your Everything NP. I want you to remember to work hard and pursue your dreams, but most importantly, take time out to smell the roses.